Hi, everyone, and welcome to OSD Parent University, our workshop this evening, which is entitled Putting It Back Together Again, Helping Your Child Regroup, Recover, and Experience Post-Traumatic Growth. I am joined here tonight by Dr. Mary McVey-Noble. I'll share a little bit more about her in just a moment, Dr. Vaccaro, and Dr. Wiesenrieder. We're going to hold off just a moment because we want to allow people a little time to get in the room. So just bear with us. We're going to let us kind of settle in. I see people are joining right now. As you join in, we're very excited to see you, and we would love to see you in the chat bar. Feel free to chime in the chat bar that you're here, and in just a little bit, we'll start communicating with you through the chat bar as well. So just bear with us. We do want to give time for people to join. Hello, Ms. Sachs. Hello, Ms. Sperico. Hello, Ms. Schaefer. Good to see you. Hello, Ms. Steins. Good to see you, my friend. Scheinsen. Mr. Kiaz is here. Ms. Remsen. All right, we're heading into the room. Hello, Ms. Penn, my co-chair of Parent University. Ms. Pikowski, Ms. Marino. All right, looks like we're in here. We're heading in, so we're just going to be another moment. Hi, Ms. Harris. Good to see you. Hi, Ms. Gordon. Ms. Ognabene, you never miss a Parent U. Thank you. Hello, Mr. Ravegna. All right, so I think we're going to give it another second, and then we're going to officially start. Yep, there we go. Hi, Mrs. Keegan. All right, Mr. Luisi, Ms. Keegan, Ms. Tanner, you're signaling that we're ready to go. Hi, Mrs. Stromer. Good to see you. Hi, Mrs. Bigelow. Ms. Cilio is here. Hello, Mrs. Scholl. Thank you for always being here. Dr. McVey, Ms. Scholl is our board member, and she's always so supportive of us, joins every one of these
Thank you.
workshops. Hi, Mrs. Borelli. We have such a nice crew here. Hi, Mrs. Bell, Mrs. Creechy. All right. We are going to get started. We will be interacting, or I'll be interacting with the chat as we go this evening, but we want to get right into tonight's topic. I shared the title with you before. It's quite a hefty title, but it's a title that encompasses all the wonderful things you're going to learn this evening. And, the word traumatic is a heavy word, and we know that. And post-traumatic anything, stress and growth can really bring a lot of ideas in your mind and feels like a heavy word, but it encompasses a lot of things. And what tonight is about is really giving us powerful and hopeful tools to help us help our children to grow, despite the things that may be happening in the world. COVID being one, but certainly I think a lot of us are aware about the recent events in the Ukraine and probably worried about what our kids might be hearing and thinking, and maybe ourselves and some of the feelings we're having over that pretty traumatic event happening in the world as well. So while those are things that might bring us a little down, I am really pleased and excited and happy to be here virtually with all of you. I'm happy to be here with Dr. McVey. Please allow me to share a little bit about Dr. McVey. She's a longtime friend of Oceanside School District and our friends here. Dr. McVey is a licensed psychologist who is also the director of the Family Trauma Clinic at Hofstra University, and that's a pretty exciting thing. She, in her current position as a school counseling, and I hope I'm saying this correctly, Dr. McVey, with the school counseling services at Hofstra, you've been there for 15 plus years, am I right?
Yes, I'm the Assistant Clinical Director of Student Counseling Services.
All right, that's why I kind of threw it at you. I wasn't sure if
That's
I got
all right.
the title right, and it's an impressive title. I want to get it there.
Really.
I'm also joined this evening with Dr. Vaccaro, who's our lead psychologist in Oceanside, and the school psychologist of school number 3, and our high school psychologist, Dr. Wiesenrieder. With that, Dr. McVey, I would love to get us started. So if you're ready, you could start queuing up your presentation. While Dr. McVey gets her presentation ready, any of our staff members out there, hang in there. In a little bit, we'll throw the attendance link up so that you can log on and share your attendance. So just be on the lookout for that. And I think we're ready, right, Dr. McVey?
We are.
All right. Dr. Wiesenrieder, Dr. Vaccaro, and I are going to step out, and we're going to let you begin.
Thank you so much. It's my pleasure to be here. I love working with this district. You live and send your children to school in a wonderful district who cares very much about them. So please forgive me, I'm getting over a yucky cold. So when I was thinking about this, the title for this presentation, I obviously kind of ripped it off of Humpty Dumpty. But I wanted to talk about what we do after things fall apart, and how we put things back together after traumatic events occur. And, we've been living through something. The other day, one of my own children, I have two teenagers, said, when is this going to be over? And the other one looked at him and said, what do you mean this? I mean, there's a lot of this. So we have been living through this. But what is this really? We've been going through a ton as a world over the past 2 years. And when I talk to colleagues about it, when I talk to my patients about it, I call it a collective cultural trauma, because very seldom do we have events that rock the entire world. And yet, over the past 2 years, we've experienced plague, which we're still in, hopefully rounding the corner on, political division, civil unrest, economic recession, and foreign war. And all of these things affect us all in different ways. Everybody experiences these events differently. They've affected families and communities in different ways, whole countries. And they've led in one way or another to profound human suffering across the whole world. And they've affected you as parents, as educators, as some of you who serve in both roles, and they've affected our children. And, when I think about this pandemic, I'm a grown woman. My life is my life. Of course, it's been altered by the pandemic, but our kids' lives have altered so profoundly. And they're so young, and they're going through a lot of different things than we are. I mean, my life was pretty stable. Of course, it was disrupted, but it remains pretty stable, even though some of my routines have changed and things are a little bit different for me. Their lives are so different, and their development is altered. And I think that's what we think about as parents and educators when we think about the impact of this on our children. So trauma, my professional hat is in the anxiety disorders and OCD, and also in trauma. And when we think about trauma, we have big traumas, and we know what the big traumas are, and we have little traumas, the traumas of daily life. And in all of the events that I mentioned previously, those intersect almost every day in very odd ways. Prior to the past 2 years, estimates suggest that approximately 80% of people would experience some traumatic event in their lives. Now, I venture to guess that those numbers are higher now. I don't know about the other 20%. I don't know who those other 20% of incredibly lucky people are. I don't know them. I'm not one of them. Most people I know have experienced a traumatic event. Often, somewhere around 38 or now probably more of those people have experienced multiple traumatic events. So of that 80, estimate would be about 38%, probably more, have experienced multiple traumatic events. There are some people whose lives seem to be riddled with trauma that we call complex trauma. But what makes an event or an experience, whether it's trauma with a big T or trauma with a little t, traumatic? Well, we don't feel in control of what's happening to us. The event is a surprise, right? It's unexpected. The individual is or feels unprepared or unable to cope with what happened. So I say is or feels. It's about being actually unprepared or the perception of unpreparedness. And perception is reality in this domain. The individual has or perceives, right? So either they don't have the ability to stop the events from occurring, or they perceive that they have no ability. Because sometimes we freeze and we don't realize what we can do. We just can't enact those behaviors at the time. We experience powerlessness, a perception of threat to self or others, maybe their safety, maybe their life, maybe just their dignity. And there's the experience of an intense negative emotion. Now, we think of trauma as associated with fear, but it can be disgust, terror, guilt, any intense negative emotion. So, and you're probably thinking, wow, I might have experienced trauma. And you might never have framed it in that way until this point. And again, everybody will experience at least one traumatic event based on this conceptualization. That 80% was probably a very low estimate. But that doesn't mean that we can't recover, lead excellent lives. And only about 20 to 25% of people will actually go on to develop post-traumatic stress disorder, which we can discuss. But kids manifest reactions to trauma differently based on their developmental level, and based on the fact that they're developing differently neurologically than adults. So when I say tots in early elementary age, I mean little ones like 3, 4, 5, up to about 9, 8 or 9, and then they become really tweeny at about 10. So that's when the shift occurs. So in little children, you'll see crying and tantrums, separation fears. They get more scared. They'll show whole new fears. Suddenly they begin to worry about safety, about death. And those fears come fast and furious. So this would be a kid who is pretty happy-go-lucky. They experience a traumatic event, or just living in the pandemic, and then suddenly they become very afraid of things that they never feared before, right? Regressive behaviors. When we talk about regressive behaviors, we mean a kid who got over thumb sucking, suddenly thumb sucking, or wetting the bed, or being very, very physically clingy, wanting to be held all the time, issues with toileting. So things that they did when they were younger that they suddenly have reverted back to. Poor eating, which usually can lead to weight loss. Sleep issues, winding up being frequent flyers in mommy and daddy's bed, nightmares or night terrors, delays in physical growth. Now, this is one that you can't believe until you actually see it. The children can fall off the growth curve because of exposure to traumatic events. People think, oh, well, they're not eating, so they're not growing. It can affect them at a neuroendocrine level, and can literally affect their hormonal release and can kind of cause a growth delay. We will also see little kids recreating trauma in play, like with their toys, playing it over and over and over again. And as tweens and teens, the picture looks a little different. I'm sorry, my voice is not so great. We begin to see the development of, similarly, right, anxiety and fear about other safety, about their own safety. So similar about those fears about safety and death, but they might begin seeking reassurance, like, are you okay? Are you going to be okay? As a parent, I don't want to go to school. I'm worried about what will happen to me at school. And we can see school refusal begin to happen. Feelings of guilt and shame. They may believe that they could have done something to prevent a trauma. They might feel very ashamed of what's happened to them. They feel very apart and separate from other people. Emotional numbing. So they'll just act like they don't care. You'll say, well, doesn't it bother you? You know, this thing happened. I don't care. Who cares? Depression and anger. Anger is a prominent one. So from little kids, the anger comes out as tantrums. And tantrums can be really severe. And then the older ones, they can be too. Self-injury. We see significantly higher rates of self-injury in teens and even elementary age. It's much less common in elementary age kids, but who have experienced significant trauma, particularly sexual trauma. but it can happen with any trauma exposure. Risk-taking behaviors. So early sexual activity, substance abuse, just engaging in really unsafe behaviors. Um, repetitive retelling of the traumatic event, because when somebody's experiencing flashbacks, they might retell it and retell it and retell it. It becomes like a script, and you'll see this change in the way that the person is talking and the change in the way that they're conveying the memory. It's almost like they shift into automatic mode as they retell it. Difficulties with concentration and attention, which result in issues with school performance, which is prominent. And if you don't know what happened, if you don't know that a person experienced a trauma, it can look just like the child or adolescent is really just being obstinate and not paying attention in school. But we also see sleep difficulties, just like in the littler kids. But it might become hypersomnia. The person, teen or tween, might get very tired. They might be struggling with going to sleep at night because they're afraid to have trauma nightmares. They're up all night, then they're crashing and tired all day. Um, Very difficult, right? So if you are seeing these reactions, please, I'm going to beg you not to ignore them. All kids go through phases. We cannot protect our children from traumatic events just because we can't bubble wrap them, and we can't protect ourselves either. I remember this moment. It was probably around this time of year, like late February, early March, when I was pregnant with my son almost 17 years ago. I was reading, I had this big red chair. It's this vivid, right? I was reading a book, and suddenly something in the book triggered me to realize that once this baby comes out of my body, he was born in April, so a couple months later he did, I will no longer be able to protect him the way that I can now. I was sitting there with my hands on my tummy and the book rested on it, and I just had this profound realization. And yet there's so much we can do to help them, right? So we can't prevent bad things from happening, but we can do so much when those bad things do happen. Talk to your child. Ask them what they are feeling, right? We don't want to put our feelings on them. We want to find out what they are thinking and feeling. And they might not be able to tell you exactly. And keep in mind, it's okay not to get the answer. It opens a dialogue. When you ask, it opens a dialogue, and it says, I am about the business of taking care of you, right? It says this discussion has now been opened, and it will be ongoing, and it is okay to bring it to me. If you see the reactions that I showed in the columns on the previous slide, seek professional help for your child. If those things go on for more than a short period of time, for in excess of 2 weeks, because sometimes we are exposed to a traumatic event and we're not okay, and we shouldn't be okay, right? Because sometimes bad things happen and we just don't feel okay, and that's all right to not be okay. And for a short time, right? So for a couple weeks, it takes us a couple weeks to get our feet under us, and then we begin to settle down and things begin to get a little bit better, and it takes about a month for us to begin to get back into equilibrium. But if for more than 2 weeks we're seeing all of those things or most of those things, then please do seek professional help. And we'll talk more about that, right? So now the good part. I love this picture, that chubby little baby hand. Oh, how do we help our kids thrive in these times? Because that's what it's about, right? We're going through something. The pandemic is not over yet. Right? But how do we thrive through this? Because there's no way around it. There is no way over it or under it. We have to go through it. And can we not thrive simultaneously? Okay, so how can I support my child during the difficult times? Because that's really, we will all encounter them. We cannot prevent them. So we don't have the superpower of doing that. Your superpower is in supporting them effectively. The first thing you can do is take care of you, right? Healthy parents equal healthy children. That doesn't mean you can't be wounded and healthy simultaneously. You can experience trauma, you can experience pain, you can struggle, and you can also model how to take good care of yourself in your struggle. My children have seen me struggle. My children have seen me in pain. They have seen me suffer. I suffer well. I can tell you that I'm super intentional about how I struggle and suffer. And that doesn't mean I haven't cried in front of them. That doesn't mean that I haven't gone through things. But I take care, vigilant care of my physical and mental health. Um, your children see everything that you do. If you think that they don't see it because it happens when they're sleeping, they have this weird preternatural knowledge of what we do. Um, they're like lightning rods, and they pick up on your mood, they pick up on your behavior, even when we think it is so far beyond their awareness. Um, they just know. And so they will just know if you're also doing as good a job as you can be. And that doesn't mean you can't struggle. Again, bad things happen and they see us go through difficult times. Being intentional about trying to get enough sleep, trying to, you know, be our best selves, and making sure that we are taking care of our physical bodies, eating the best that we can, getting some exercise when we can. And okay, you can't make it to the gym, but my kids my kids see me running up and down stairs and doing crunches when I can do them. um, Taking them for a hike, doing whatever you can when you can do it in order to nurture yourself. My kids, I'm very intentional about meditating. I'm very intentional about praying. My kids see me do all of the things to take care of every aspect of myself. And they know what, if you ask my kids, how does mom get through a hard time? They could tell you. But what that's done is teach them what they need to do. So they don't do the same things that I do, but they know what they need to do to get through hard times. And that's really important. Create structure. Have routines that you can depend on in your home. It's really important. They're important for us. I have a bedtime, I have a wake up time, I have times that I do things, not rigid ones, right? So if they can't go off like a shot every day, that's okay. Um, but it helps, right? It helps our brains and our bodies fall into routines so that we're releasing certain um, neuro, neurochemicals and certain, hormones at specific times of the day that help us regulate everything better, right? Focus on your values, be explicit, be intentional, and be open about those. Talk about what's important to you, what you are willing to make sacrifices for. Live those values. Engaging in value driven behavior helps, right? Especially when you're going through something really difficult. Um, Winston Churchill said, when you find yourself in hell, keep going, right? So when things are very difficult, keep moving and move toward the things that you value the most. A lot of times when we're in a painful situation, we stop because we just don't know what to do. So we fall down and we stop. And it's so understandable. It's such a human instinct. And yet it's the least helpful thing that we can do. It's the least adaptive thing that we can do. And so the goal is to just take one step each day toward, and now it's what it's toward that matters, not away from. We don't want to live under aversive control. We don't want to be running from painful emotions. We don't want to be running from, dealing with the things that are difficult for us. And we don't want to be running to escapism and substances. We want to be running toward things that mean the most to us, the people, the relationships, the principles that give our lives meaning. Because when we are far from our values, far from the things that are the most important to us, we feel this dissonance, this friction within ourselves, and it doesn't feel good. But if we can live out our values every day, even if we're taking tiny steps in our great pain toward those things, life gets better. and be as present as you can in the moment, and focus on finding the balance between creating comfort, right? Because when you're in a lot of pain, you do want to engage in good self-care, find comfort, right? And safety in that moment, but developing strength and growth in the future. So when things are very difficult, we need to sort of huddle in, keep it tight, big family hug, but then also think about what can we do tomorrow in the near future to help ourselves rebuild and get strong again. So setting the stage for post-traumatic growth. So when we go through very difficult events, anybody who I've ever treated for PTSD or post-traumatic stress disorder, which is not just a reaction to trauma, but what happens when an individual gets stuck in their reaction to trauma, and the anger and the emotional numbness and the flashbacks and nightmares and re-experiencing and avoidance, and social isolation withdrawal that occur subsequent to that. Whenever I've treated somebody for that, life has this very clear dividing line, and the clear dividing line is the trauma. There's life before and there's life after. And I hear people, I know that this pandemic, that COVID-19 has been a trauma for people because we hear people talking about the before times, which implies that there will be an after time. But the dividing line has been for those people, this pandemic, those people being us, all of us, because it is happening to all of us. So we don't get to choose that a trauma happened. That is why, like we talked about just a little bit before, that's why it is a trauma. That's the nature of the event. But we can, and I say at least to some degree, and I'll talk about this in a second, choose how we recover from it. So we might not be able to choose that we have incredibly high anxiety when, something that reminds us of the event happens, right? We might not get to choose that we're hypervigilant or very aware of our environment when we're in the environment where the trauma occurred. We might not get to choose that our hearts race, when we're presented with specific stimuli, but we get to choose how we respond to that. I'm going to stay in this environment. This environment is not going to bully me. I'm going to, I'm going to expose myself to my fear because I know that thing was a random event and it's not going to happen again, even though I feel like it will. And I wrote this next little statement, and I meant it so seriously. Years ago, when I went through a significant trauma of my own, somebody said to me, "This is happening for you and not to you." And I didn't receive it well. I didn't say anything to her. I knew that she meant well, but it felt like she had stabbed me when she said that. I was like, how is this horrible thing that is ripping my life apart happening for me? It's happening to me. What are you talking about? But as I healed, as my life came back together, as my life improved, as my life got better than it had ever been, I realized that it did happen for me, that it took this series, actually, of very painful events to show me things about myself, my own abilities, my life, who I had in my tribe of people who I love and support and who love and support me, to really prove that this actually, I would not change anything about what happened. And I realized it had happened for me. So when we realize that things do happen for us and not to us, And it seems almost impossible and naive to talk about the worst days or events or losses in our lives as growth opportunities. But if you have been through a really traumatic event and you come out on the other side, you realize that it can constitute one of the greatest growth opportunities of your life, right? And I think about it this way. So when trauma rips through your life and all that's left is a gaping wound, opportunity for healing exists. You have to be wounded to heal. If you're not wounded, you can't heal. And you can't heal if you're not wounded. Negative, ugly, traumatic events create space for positive, beautiful developments in our character, how we choose our new lives, use our talents, and how we choose to treat others, ourselves, in our relationships, our spirituality, in every aspect. Life in the wake of trauma can be richer, more meaningful, and more intentional than pre-traumatic life ever was. And that's the truth. So what is post-traumatic growth? The term, the phrase, the theory was coined by Tedeschi and Calhoun, they're two psychologists, and it was developed in the 1990s to describe the positive transformation that happens in some individuals' lives after they experience trauma. Now, I didn't hear about PTG until probably like the mid 2000 teens. I was reading a book called, it has a red balloon on the cover. I talk about it all the time. Option B. And the woman who wrote Lean In, I'm going to, of course, forget her name too, wrote this book after she suddenly lost her husband while they were on a vacation. And she wrote the book with her therapist, but she refers frequently to post-traumatic growth in the book. And since right around that time, the field of post-traumatic growth has been exploding. Post-traumatic growth is not resiliency. Resiliency is like a buffer personality trait. It's our bounce back ability. So really a person who is high in trait resiliency doesn't need to go through post-traumatic growth because they probably won't ever experience post-traumatic stress. To achieve post-traumatic growth, you have to experience the distress, the confusion, the wounding that happens after a trauma. And post-traumatic growth allows you to put it back together in a more meaningful way, right? So you have to be shattered to come back together. And this makes me think of this Japanese art. When a bowl breaks, you don't gather the pieces like I would in my own kitchen every time I break something and throw it away. You gather the pieces and you take molten gold and you fuse them back together with molten gold, which creates a piece of art. The thing might not be functional anymore, but is now turned into an art form. So that brokenness becomes beauty. And that's literally what post-traumatic growth is. So these are the 5 domains or the 5 areas that post-traumatic growth occurs in. An increase in appreciation for life, developing new relationships with others or richer and deeper relationships with others, recognizing new possibilities that exist in life, development of personal strength or recognition of personal strength, and spiritual change. It doesn't have to be religion, it can just be one's spirituality, but these are the 5 domains that we see post-traumatic growth occurring in. And we can see this in children, and you can nurture this in your children. So how do I do that? How do I cultivate that in my child, like that little plant? How do I feed that plant well? So one way is by encouraging the daily practice of gratitude. So in our worst pain, we don't think, what do I have to be grateful for? But I actually kept a gratitude list. And I had my kids do it too when we were going through something very difficult. And they would say, why do I have to think about what I'm thankful for? This is the worst thing I've ever gone through. And then they began to really enjoy the practice. And they began to thank people. and they began to feel really good. And that simple practice of gratitude deepened their relationships, um, helped them really recognize what they had in their lives, not what they were lacking. Um, you can focus on the explicit expression of values. This models the behavior for your kids. So you say, you know what is so important to me? This thing. Do you know how I show that every day? I do this thing. um, and you get them to do it too. Even little children can tell you what's most important to them and how they show it. Um, routines. I know that people like cringe when I say that. It's really important. Um, mealtime routines. No matter what's flying in my house, I sit down with my kids for dinner. um, even tonight, I had very little time. But I was like, guys, it's Fat Tuesday, and I brought dinner home. I never bring dinner home. I always make dinner, and they were thrilled that I didn't cook. um, and we ate dinner at the kitchen table, and then I ran upstairs and finished my dinner here. Um, but we ate dinner together. Just establishing little routines that everybody can depend on brings joy, brings the expectation. People get excited when they know it's time for X, Y, or Z. Just little stuff. When I say ramp up the rigor in all domains of functioning, I mean challenge yourselves. Get excited about challenging yourselves. Whether it's in, your family hikes, you usually do this thing. Let's go hike someplace that maybe it's a little bit longer. Maybe it's, a little bit harder. Let's see what we can do. Let's challenge ourselves. Let's walk farther with the dog. Let's wake up a little earlier. Let's have a heroic minute where we don't hit the snooze button and we get up and we jump out of bed and we make our beds. Let's, take on a task of, making sure that everybody has an empty, hamper by the end of the week, and all the laundry is done and folded by Sunday. Um, and just little challenges that really help everybody kind of work on being their best self. Do for others. When we are in great pain, when our suffering is great, we do well for ourselves when we extend beyond our own suffering, go outside of ourselves and do for another person. When we actually look outside of ourselves and see that other people suffer too, and maybe more profoundly than we do. And it's always healthy and helpful to do for other people. Reinforce random acts of kindness at home, even when things are hard. It doesn't have to cost money. I leave love notes. My kids now leave me love notes. That's so sweet. They're surly teenagers. Found out sometimes, they curse and stuff, but they're great kids and they leave love notes. And I think that's so sweet. And I don't tell them leave love notes, but they do. And I love that. And sometimes they're for me. Lean into faith or spirituality. Help them recognize that there is something bigger than they are. And if you're not a religious person, that's okay. They can focus on nature. They can focus on the universe. Whatever it is, something bigger than they are that is, benevolent. Focus on kindness. Focus on love. Whatever it is, but really the nihilism that exists in today's world among youth is staggering and causes them to feel afraid and alone and so much pain. There's nothing out there. There's nothing for me. There's nothing, nobody cares. That whole idea and belief leaves them so emotionally destitute. And so really helping them to root their feet firmly in something so that they can grow. beyond that is very helpful. And you can do that by modeling it too. So you've all been through something significant. When do you push, right? Because when we are scared, when we are stressed, we kind of snail in. We don't want to extend ourselves, and we get afraid, and we avoid, and we don't want to do things to expand our horizons, and we don't want to do things. Period. We don't want to call friends. We don't want to leave leave the house. We don't want to go to school. We don't want to go to work. We want to just kind of hunker in. So if your child is struggling, they're clearly going through something. They're not quite themselves, but they're not having significant functional impairment. That means in all of their major domains of daily functioning, they might be showing a little bit of difficulty, but they're doing basically okay. They're not too far from their own baseline. You can push a little. You can say, hey, let's challenge ourselves to do this thing, to practice opposite action. I know you really want to, I notice that you've been kind of like keeping to yourself. It would be really helpful if we did something maybe a little extra social, like called some of your best friends, even though you feel like you don't want to do that at all, just to stretch ourselves a little bit so that we can get back into that again. Know that you can tighten up the structure of consistency. And, as parents, we feel like, I don't want to do that. But sometimes we have a real sense, like, I know that I could do my part better. I know, and we all drift. We all regress from the mean, right? We know that bedtime is a good thing, and then bedtime starts creeping back and creeping back and creeping back. But then the later bedtime creeps back, the closer we get to insomnia, the closer we get to sleep dysregulation. So, like, as parents, we all know when bedtime is creeping back, and we know we have to tighten up the structure. We have to tighten up the bedtime routine. Like, every single parent on earth has been through this, and that might just do the trick. When your child is avoiding things they're uncomfortable with or anxious about, right? So I recently had a parent call me and say, my 6-year-old, and the parent is the person that I work with, but she said, my 6-year-old, because the 6-year-old was, very nervous about going out into public where people were no longer wearing masks, and the parents hadn't talked about it. The 6-year-old had just sort of like noticed it and internalized it. A family member had passed away from COVID. She said she doesn't want to leave the house anymore, but the fear she emerged with was not related to masks at all. I mean, she'd spoken about it, but the fear was that there was going to be an active shooter somewhere, and she was worried that somebody was going to harm them at a public place. So she said she wasn't going to any public places. And she wasn't showing, she didn't want to leave the house. And so they were having her not leave the house. And she was, if they had to, she was saying, doing a lot of reassurance seeking. Are we safe? Are we safe? Are we safe? And I gave the mom, a little bit of language she could use about talking about worries and how worries are fears, not facts, and they're feelings, not facts. And how if you give into them, if you feed them, they grow. We don't want them growing. And so how it would be important not to just take the child to like a Broadway play where it's busy and crowded, but maybe starting with something like making like an exposure hierarchy with the child, like what's a place where you're very comfortable, the park, what's a place where you're a little less comfortable, the mall, what's a place where you're a little less comfortable, but a mall is still big and there's space, what's a place where you're a little less comfortable than that, for whatever reason, Target. So help mom construct an exposure hierarchy with her so she could do one thing, win at it, feel comfortable doing it, or do it with anxiety but feel like proud of herself for doing it, and then go right up and do the next thing. And then when you know your child is not at their limit, even if they're giving you a hard time. So this little one was giving her mom a hard time and, kind of pushing back and really struggling with it. But mom knew she was still technically okay. right? She wasn't completely losing it or tantruming or, clinging to the door. She was pretty okay. She was a little tearful, asking a lot of questions, but mom knew she had some room to wiggle. When do you seek help? Right? So there's a kind of a dividing line. There's a bright line here. So when we seek help, is when there's significant functional impairment and significant subjective distress. And what that looks like is when your child is showing impairment, difficulty functioning in one or more of these important domains of daily functioning: school, social functioning, sleep, eating, or age appropriate independent activities of daily living, like taking a shower if they're old enough to take a shower, or brushing their teeth. Like, this is a kid who's become so depressed that they can't get out of bed, they can't brush their teeth, they're not taking showers, they're wearing the same clothes for days. That's some pretty significant functional impairment. When your child is showing more than transient, right, more than passing emotional distress, depression, anxiety, anger, guilt, these sorts of things. And when those two things are present, we know that we now have the clinical presentation of an issue that it's really advisable to seek help for. Okay. Giving grace. So I want to end this way before I open up for some questions, because in the very beginning of the pandemic, I can't believe it's been 2 years. I remember March 1st of 2020, and I remember reading about what was happening in the world. It wasn't quite here yet. It was starting. I remember a sense of anxiety. I bought the laptop computer I'm presenting to you from then because I felt like there was a rising tide of something not good coming and that I might need to be able to work remotely. And I remember some coworkers who thought it was silly, and some coworkers who were saying, what are you thinking might be going on? And we were talking about it. And then it happened, and people's reactions were broadly different. And I sort of adopted a philosophy of giving grace because I didn't know what anybody was going through. And I know some people really struggled with that. And I know some people gave me a lot of grace as well. And so I just wanted to say this because it's so easy. I've seen so many people divided. I've seen marriages end. I've seen families fall apart. I've seen best friends no longer speak to each other because of differences of opinion, of just, I've seen people go through so much pain as a therapist and as a human in the world. So I'm saying this because I know you know this. I just want to remind us all, because we all belong to each other, but everybody is going through something at any given time. Some people are able to conceal their burdens and some aren't, regardless of what you think about how someone else is acting, even if it's really bad. Give them grace. Reserve your judgment. Show them kindness. Not grace is literally the definition is kindness, not because they deserve it, but because at some point you received kindness that you surely did not deserve. I know I have. Walk and talk gently. Listen more than you speak. Apologize when someone says you have harmed or wronged them. And it's not always because you think you're wrong, it's because they felt that you wronged them. And I don't want somebody to feel like my actions have hurt them, so I can be sorry for that. Not just when you think you have done something wrong. Let go of the idea that you need to be right at all costs, and recognize that sometimes preserving a relationship or protecting someone's heart is more important than rightness. Most of all, do your best to make sure that people walk away from interactions with you feeling loved. So, with that, thank you for giving me grace. I'm sure that you've tolerated my imperfections in this talk, and I can close this Diana, if you want
You know what,
to.
Dr. McVeigh, just for one moment, I
Sure.
would love for you to leave this on the screen. We're all in the room right now, so I did welcome
Okay.
back Dr. Vaccaro and Dr. Weisenreiter.
Okay.
But I do want to leave this one slide on the
Sure.
screen for just another moment.
Okay.
If I was a participant out there, I'd take a picture of this because
Uh,
the words are beautiful and there's
thank you.
something to remember. And this alone, when you remember these actions and this type of mindset, you bring goodness into the world, and that's growth. And that's a wonderful thing to model for our kids. So thank you. This was beautiful.
Oh, thank you.
So what I will say now is if you can take this slide down so we can get you back in the room where you could see everyone.
Okay.
For our participants out there, we're going to do a couple of things right now. I'm about to post the attendance link for our wonderful staff members who are here. And I have to say, we care so deeply about our students and the staff members and the community members and the parents that are here this evening. We're all in this together to bring goodness to them. And part of that is taking care of us. So that resonated with me too about taking care of us. And that's our teachers, our parents, our board members, our community members. I'm going to go ahead and paste the link to the attendance right now for our staff members.
Okay.
You can all cut and paste the link and access the attendance. I always share with our staff members before we get to the Q&A. Please don't worry. If you have difficulty accessing the attendance, please email me. We will work it out with you. I would love to take this time. We did get 2 questions emailed to us, and we got 2 questions in the chat bar. So I'm going to go with a question from the chat bar,
Sure.
a question from the email. So the first one comes to us from Ms. Pikowski. I'm looking for it, so bear with me. And Ms. Pikowski writes, I don't know if you could see that. How do you get someone to get unstuck? I love that phrase, in a post traumatic incident that they may have experienced. So I turn that over to our experts and see if we can give some thoughts to that. I know we won't solve the whole thing, but a few thoughts.
So, I'm assuming you mean like a flashback? I just want to clarify before I answer.
I'm not sure.
I think, Dr. McVey-Noble, I believe that comment came in, or that question came in when you were speaking about post-traumatic stress disorder and the difference between the combination of post-traumatic growth. And you were talking a bit about post-traumatic stress disorder and people being.
So, sure. So typically, post-traumatic stress disorder, like as a clinical entity, doesn't just resolve on its own. Normally, we need some sort of therapeutic intervention to assist with that. And the best practices tell us that exposure-based therapies are most effective for that. And there are a variety of them. It doesn't have to be straight exposure. Some of the most effective therapies use a combination of exposure and cognitive therapy, focusing on restructuring the trauma-based beliefs in combination, separately though, with helping the person face the cues and stimuli related to their traumatic event. In a variety of different ways. So there are different techniques, but the most effective therapies involve helping that person change how they think about themselves in relationship to their trauma, as well as exposing them to the feared stimuli and helping them reduce their behavioral avoidance. That said, if somebody is in a flashback, it's really important not to try to intervene, because that means they're actually re-experiencing the event as it happened. I was literally doing therapy with somebody yesterday who was describing a flashback of an intense traumatic event that she experienced as a child. And she said it was so weird. I was literally seeing it and hearing it in front of me. It's like I was blind and deaf to what was happening just now in the moment. And she felt a sense of complete terror, and she got hurt because she was running and screaming, and didn't see or hear where she was. And so, the best thing that you can do is try to help a person remain safe. And, there are certain sensory grounding techniques that we teach people to assist them with coping with the dissociative qualities of a flashback or traumatic re-experiencing, like putting their feet flat on the ground, kind of squeezing their own body to bring them back into their own body in the moment, using temperature extremes like cold, to kind of bring them back into their present moment. Things like that.
Thank you. So our next question is on the screen now, and it's interesting because it does remind me of the events that are happening in the world. And the participant wrote, "I'm frightened and stressed about some of the things going on in our world. What are some tips regarding what to do with my anxieties and emotions so that I can help my kids through these times?" That's a great question because we're experiencing it, and you don't want to necessarily put that on our kids. So great question. If anybody could please take that, that'd be great.
I think actually Dr. McVey mentioned this earlier, that healthy parents, healthy families equals healthy children. So it's really important that we take care of ourselves and do what we need to do so that we can be there for them. I think it's really important that our responses to children is based on their developmental level. So a response to a younger child is going to be a bit different than a teen or a tween. So young children might be asking questions, and your response should be limited in terms of the details. And it directly should answer their question, but sometimes their questions are very like, what do I do right here, right now? Or how is this affecting here? And we have to be careful not to say, yes, let's talk about what's happening. Let's talk more about a war. My teenage son asked me the other day, am I going to get drafted? So sometimes it's a very specific thing, and you can answer that question if it's, appropriate. But we also don't want to gaslight them and say everything's fine, move on, because it's not fine. So I guess the main idea is to gauge their developmental level, answer their questions appropriately and fairly, but also reassure them so that they know that they're okay. It's difficult, but we're okay and they are okay. And just, another suggestion with that is to really limit access to media, the news, not just for our kids, but for ourselves. Every time we, hear, see, traumatic events, it's re-traumatizing ourselves, and our kids are listening. They hear everything that we're listening to. I don't know if anyone wants to add to that.
Try not to keep the news on the television. Just don't. Read the news on your computer if you want to, or newspaper. I don't even know what those are anymore. But you don't need to watch the news in front of the kids all the time or have it on just streaming news. It repeats. You only really need to hear it once or watch it once. And, I think that's the point.
I'm a little guilty of that myself as an adult. I have to turn it off after a while because you're right, it repeats. So with that, we have two more questions. This is our third, and then we'll have a final question following this one. We thank Mrs. Mark Antonio.
Thank you.
How can we get our children to feel like they belong again? And that's in school and feeling left out. And that is something that some of our teens and kids are going through after kind of having to be forced to be apart a little more than is normal. So any thoughts on that one?
I don't want to monopolize, but
do it, please.
Really living this with three teenagers. And I think the same way that we had to work hard to, keep people separated and keep them safe, now we have to work hard to, bring them together. It's just too easy to say, oh, you know what, Mom, I don't want to go to that event, even though, my friends are meeting at the park. I don't know who's wearing a mask. I don't know if it's safe. I don't know what is. And I think we have to almost stage it a little bit right now, and push them. And Dr. McVey talked about that slide when to push. I think we have to push a little bit with that.
Yeah.
And I also just wanted to mention, in school feeling left out, if there's something else happening in school, feel free to reach out. We're fortunate to have a variety of different staff members on our school mental health team, psychologists, social workers, health and wellness teachers, guidance counselors. Feel free to reach out if there's something specific that we can do to help.
Perfect. And our final question of the email of the evening was emailed to us. I think you all sort of touched upon this, but it's here, and let's just give it one last component because one last answer, because I think it's important. I think that sometimes, as parents, we do struggle as to when it's time to seek therapy versus this is a behavior we can get through together with some of the wonderful strategies that was shared with us. So one final time, how do I know it's time to seek therapy for my child and it's not typical behavior we're going to get through together?
I think one of the things that we've been discussing in preparation for this evening is this idea of having a good idea of what your child's kind of baseline functioning was before, and if you're noticing a very significant change from that. Or Dr. McVey was talking about the idea of all those different categories of functioning, and is your child not functioning the way that they typically did socially, educationally, all those different realms of life. Those would be kind of some indicators that it's time to seek some professional help. And so really that functional piece and keeping in mind where your child's typical baseline is. And just like Dr. Vaccaro was saying before, we have a lot of pupil personnel services at our schools who would be happy to help families kind of navigate and discuss that together, if that's something that you're wondering about.
So we've come to the close of our presentation with our incredible speakers this evening. I can't thank Dr. McVey-Noble enough for your wise and calm presentation. It was almost, I was so tuned in by listening to you and how you speak and the things that you were sharing. Thank you to my absolutely wonderful partners in Parent University when we're bringing these kind of workshops together, Dr. Wiesenrieder and Dr. Vaccaro, who always kind of support me on these Q&As in the end. Also, your expertise and your support of our children every single day means the world to us. I want to thank the incredible individuals that were here this evening. I can't tell you how many parents and staff members I recognize and how many people are here from our community. It just goes to show how much we care about our kids and how much we care about each other. I just want to put, Ms. Harris, forgive me, but I am going to show this because I think it matters. Give them grace. Nobody knows what anybody is going through. Let's do that. Let's give each other grace. It's been a tough time out there for communities, not just ours, the world. Yeah. So let's get back to choosing kind. I also want to highlight something that Ms. Sperico said and typed in the bar. She said, it takes a village. That's an old little statement that everybody used, but I love what she said right after that Oceanside is a great one, and we are.
That's true.
All that we've gone through, no matter all the difficulties and kind of the anger that's out there a little bit too, we are a great place. And there's lots of great people in here this evening who are here for kids and each other. So thank you all. I hope you enjoyed tonight's presentation and gained one golden nugget that you could take with you and carry forward. Thank you again to our guest presenters. And I wish everybody a wonderful evening. Have a good night.
Take care. Good night.
Good night.